the median nerve. In this video, we learn about origin of the median nerve from the brachial plexus, its course through the arm, forearm, and hand, the muscles it supplies, the sensory areas it innervates. The median nerve arises from brachial plexus in axilla by two roots, lateral and medial. The lateral root, with the root value of C5, C6, and C7, arises from the lateral cord of the brachial plexus, and medial root, with root value of C8, and T1 arises from the medial cord of the brachial plexus. The medial root crosses in front of the third part of the axillary artery to unite with the lateral root in a Y-shaped manner, either in front of or on the lateral side of the artery, to form the median nerve. So the root value of the median nerve is C5, C6, C7, C8, and T1. Axilla, median nerve, lies on the lateral side of the third part of the axillary artery. It enters the arm at the lower border of teres major. In the arm, initially median nerve lies lateral to the brachial artery and then crosses in front of the artery from the lateral to medial side. At the level of mid-humerus, after crossing, it runs downwards to enter cubital fossa. In the cubital fossa, the median nerve lies medial to the brachial artery. In the cubital fossa, it gives muscular branches from its medial side to supply all the superficial flexors of the forearm, such as flexor carpi radialis, palmaris longus, and flexor digitorum superficialis. Median nerve leaves the cubital fossa by passing between the two heads of the pronator teres. At this point, it gives off the anterior interosseous nerve. The anterior interosseous nerve is purely motor and supplies 2.5 muscles: flexor pollicis longus, lateral half of the flexor digitorum profundus, and pronator quadratus. In the forearm, the median nerve passes downwards behind the tendinous arc between the two heads of the flexor digitorum superficialis and runs deep to the flexor digitorum superficialis. After 5 centimeters, proximal to the flexor retinaculum, the median nerve emerges and becomes superficial, lying lateral to the tendons of the flexor digitorum superficialis. In the mid-arm, the median nerve gives muscular branch to the radial head of flexor digitorum superficialis, which gives rise to tendon for index finger. Before entering the carpal tunnel, it gives off its palmar cutaneous branch, which passes superficial to the flexor retinaculum to supply the skin over the thenar eminence and lateral part of the palm. The median nerve, by passing through the carpal tunnel, where it lies deep to the flexor retinaculum and superficial to the tendons of flexor digitorum profundus and flexor pollicis longus. In the palm, the median nerve flattens at the distal border of the flexor retinaculum and divides into lateral and medial divisions. The lateral division gives a recurrent branch, which curls upwards to supply the nar muscles. It then divides into 3 palmar digital branches. The medial divisions give off 2 palmar digital nerves. The 5 palmar digital nerves supply sensory innervation to the skin of the palmar aspect of the lateral 3.5 digits, including nail beds and skin on the dorsal aspect of the distal phalanges and first and second lumbricals. A median nerve is also termed laborer's nerve because the coarse movement of the hands required by laborers, lifting weight, etc., are performed by the long flexors of the forearm, which are mostly supplied by the median nerve. And that's the median nerve, the lifeline of your hand's movement and touch. Thanks for watching.